Does everybody want to go on mute now and then let Aman start?
Just share my screen. So hi everyone, welcome to our second COVID-19 vaccination, your questions answered webinar. So hello to all those that joined us last week, and hi to the new faces. So today we are again joined by our local GPs, healthcare professionals and commissioners in Merton. So just wanted to start off by saying that this is the first of a series of sessions. So it's the second of a series of sessions. We held our very first session last Sunday. This is our second event. And what we would like this session to be is kind of to hear a bit from you about the sorts of things you've been hearing in regards to the vaccination programme, any things that perhaps aren't true that you've been hearing, any myths. And then we'd like to do a series of smaller sessions after with particular community groups, perhaps in different localities in Merton. And we'd also like your take on what would be helpful. So what future sessions would be helpful. So this is our second session. So I just wanted to start off by to do some housekeeping. It's a live session. So not only are we being joined on Zoom today, we're also live streaming on YouTube. So it's great to see some of your cameras on, just to let you know that we're recording the session and it's also being live streamed. But it's great to see some of your faces. So feel free to keep your cameras on and turn them off if you prefer. It would be great if you can stay muted just for the duration of the presentation. We're going to be covering some updates and then we're going to be handing it over to you to hear about the sorts of things that you'd like to share with us, your thoughts, and we're also on hand to answer any questions. So for the questions portion, we'll be answering some questions in the chat box. So please feel free to type your questions in the chat box. But most importantly, we'd like to make this session as interactive as possible. So please start to raise your hands following the presentation, and Ben and I will be going through and picking some of you to ask your questions, and then hopefully we can start an interactive discussion from there. So it'd be great to just stay muted for the duration of the presentation and then unmute to share your thoughts with us. So thank you everyone again for joining us today. We hope you found this session useful, and please feel free to give us your ideas on what we can do in the future as well. So I'll just hand over to Dr. Mohan, who's going to be chairing today.
Excellent, thank you, Aman. That's great. And if we could have the first slide. So I'm Dr. Mohan Sukh, I'm a GP in Merton, and I'm also the East Merton locality lead. And it's a real pleasure to be chairing today's session. And certainly last week, I'd like to start off by thanking our expert panel who came last week and have kindly agreed to do the same again, because we had such a big demand and a real need for this, and we're all more than happy to have a repeat session. So I want to thank everyone. We're going to plan for an hour to start off with. If there's lots of questions, then we will extend for an hour and a half. And as Aman said, we want to change things and we want to ask you questions. So we'll give you an opportunity to put your hand up and ask questions directly at the panel. So what's the aim of today? The aim of today is to support our community, so Merton community, around the understanding of COVID and the vaccination programme. And I've got some questions in yellow, which hopefully we'll answer today. And if you want to ask, then please do. So next slide, please, Aman. So before we start, maybe we'll introduce the panel. So we go clockwise. So I'll introduce myself. So Vasa, did you want to unmute and introduce yourself, please?
Hi, good evening. I'm Vasa, Clinical Chair of Merton.
Thank you, Vasa. And Fiona?
I'm Fiona White. I'm a nurse consultant in primary care. I also work in a local GP practice in Morden.
Thank you, Fiona. Sakib.
Hello, everyone. My name's Sakib Ayub. I'm a GP at the Colliers-Wood Surgery.
Thank you. Barry?
Good evening, everybody. My name is Barry Causer. I'm the Head of Strategic Commissioning in Merton Council's Public Health Team.
And Adil.
Hi everyone, it's Dr. Adil Siddiqui. I'm a GP in Wimbledon for around 7 years now. Thank you.
And Aditi.
Hello everyone, I'm Aditi Shah, I'm a local GP and a West Merton locality lead.
And Sadina?
Hello, I'm Sadina. I'm the Chief Pharmacist for Merton, where I worked for 20 years, and I also work in the COVID vaccination clinics.
Excellent, thank you, Sadina. And I think we have Geeta. Did you want to introduce yourself quickly?
Hi everyone, I'm one of the non-medics on the panel. I'm coordinator of the Sri Ganapathy Temple in Wimbledon. I'm also chair of Wandsworth Community Empowerment Network and also sit on the Faith Sector panel in London as a trustee of London Borough's Faith Network.
Excellent, thank you, Geeta. I'm not sure, I don't know whether Malik is online, if you wanted to say anything, Malik. No, okay. And we've got Ben and Aman who are also helping as well. Could we move on to our next slide, please? So what is COVID? So we've got some slides, just a bit of information. We'll get through these fairly quickly, allowing a lot of time for you guys to ask questions. So it's the illness which is fairly new in the last 14 months. It affects everyone very differently. It can make you feel very poorly, can cause pain in your chest and make you breathing very difficult. And certainly the three symptoms we ask is cough, smell, high temperature are the ones to report, certainly, which could suspect COVID. Currently, we have close to 4 million cases in the UK as of the 4th of February, so 3.8 million. And in total, 110,000 COVID associated deaths in the UK. So the reason why we're here, to see how we can overcome that and support that. And certainly the vaccination is our best protection against COVID-19. Thank you, Aman. So what is the picture in Merton? So there's a nice map there of Merton, which Barry and the team have passed over. And certainly you can see it's certainly more colourful than it was last week. But you can see in the east of the borough, there's a higher infectivity rate, but also in the west as well. So the whole of Merton, you can see where the scattering is. So the darker the patches, the higher the infection. And you can see this is still quite a fair bit of infection across Merton. Thank you, Aman. So I want to talk about the number of deaths in Merton, certainly over the past year. And that number in the top right-hand corner are the number of deaths which we've had in Merton, so 376. And so in the past week, we've had 40 or so. And as you can see, if we cast our way back to the first wave, in the middle of April, we had 107 non-COVID deaths and 51 COVID deaths. And that was in the peak of wave one. And why that's important, it just goes to show that while we're also having COVID deaths, we're also having non-COVID deaths. So it's important that we also support some of the non-COVID symptoms. But today's webinar is about the COVID vaccination, but it's just an interesting feature to take on board. And certainly, as the peak subsides in wave one, we can see it happening again in wave two, which is where we are now. So again, this gives you a flavour of where we are in Merton. Thank you, Aman. We can move on to the next slide. So there's been quite a lot sort of in Merton this week, and I'm going to hand over to Barry to just talk about the enhanced COVID testing which we've got in Pollard's Hill. So Barry, over to you.
Thank you, Mohan, that's great. And thank you for the opportunity to talk about the enhanced testing in Pollard's Hill with our attendees this evening. What I can say to you is that last Sunday, the government announced that there were 9 areas of the country that through routine surveillance identified a very small number of the South African variants across the country. And you would have seen a lot in the press and the news around this enhanced testing. What I can say to you this evening is that there was one person in the Pollard's Hill area of CR4 that was identified with the South African variant. This was back in January. That individual has isolated, they've recovered, and all of their close contacts were traced. So the system as it was has worked effectively. To reassure our attendees this evening, the evidence so far shows us that the South African variant does not cause more severe illness or disease. but in a similar way to the Kent variant that we've heard a lot about, it does infect people more easily, and it does potentially have a mutation that makes vaccines slightly less effective, but the studies are still underway on that particular aspect of the variant. So within Merton, within the Pollards Hill, there are no additional restrictions put in place across Merton. So we all need to follow the same national lockdown restrictions, which is essentially to please stay at home as much as possible. If you're able to work at home, then continue to do so. If you are able to go to work through the national restrictions, then please continue doing so. So what we have put in place since last Sunday evening, there's enhanced testing over the next 2 weeks. And the purpose of this testing is to track the virus and to identify any cases so that we can control any potential spread of that variant, so that we can get them to isolate. So there was no immediate public health emergency with the South African variants. The purpose of the testing is to track any new cases. So we are encouraging all people that live, work, or visit Pollards Hill area for essential activity, perhaps a childcare bubble, to get a one-off asymptomatic PCR test. So we've put in place this week, there is a mobile testing unit outside the front of Pollards Hill Library, and you're able to book in advance via the website. You can go and pick up and drop off a test at the New Horizon Centre, so Commonside over in Pollards Hill, and you can do that between 8:30 in the morning and 6 p.m. each evening. And we've also got a team of our council workers knocking on doors, answering questions, and just explaining a little bit more about the what, the why, and the how to access testing. So very briefly, that's an overview of the enhanced testing in Pollards Hill. What I would say that through as I said, no additional restrictions, and so please continue to attend your medical appointments. And if you're invited to attend a vaccination appointment, please continue to do so. This new testing regime does not stop you doing those things. Thank you. Over to Mohan.
Thank you, Barry, and fairly comprehensive there plan in terms of what the testing involves. If we can move on to the next slide. I also want to mention, I forgot to say that we've got 3 members of our panel, so Aditi, Adil and Sadina, who will be answering some of the questions on the web chat. So please do keep them coming in. So yeah, just so that we may answer some of those questions in our presentation anyway, but please do bring them in. So the good news, certainly with the number of deaths, so there's 110,000 in the UK, and so we've got the vaccine. So the vaccine increases your immunity to the virus, and therefore is our best protection against the virus. And at present, we don't know whether it stops you spreading the virus, and so you still need to wear a mask, wash your hands, and social distance after you've been vaccinated. So it's really, really important that we continue to do that. So moving on to what vaccines are available. Sadina, I'm going to hand over to you if you could just give it a description of what we have.
Okay, so in the UK at the moment, we're using 2 different vaccines in our clinics. Most of the clinics in the community will have either of these vaccines on any one day when you attend a clinic. You would have heard that there are some other new vaccines that have come through. The thing to notice that the MHRA, which is the body that does robust testing on all the vaccines before they are authorized for use in the UK, will look at all of the new vaccines as well. They have looked at these 2, and they've given us all the information to enable us to vaccinate, and they've done all the testing, and they have passed all of these vaccines. They are safe, they're efficacious, and so anybody having the vaccine should be assured that whichever of the 2 that they're getting, that it will be safe for them and it will be effective for them. If you have any questions about the vaccines, do have your medical records and be able to speak to you about your individual situation. There's a lot of misinformation out there. The best thing to do before you make a decision is all your questions. Mohan.
Thank you, Sadina. That's really great. You did sort of cut out a little bit. I'm just wondering whether you might want to turn the camera off, just if we ask you again, just because right at the end. But that's great. Thank you. Next slide, please, Aman. So few questions about what happens when we get to the vaccination hub, and I think Fiona's been doing plenty of shifts there. So I'm going to ask Fiona just to explain what happens, the process in the vaccination hub.
Thank you. So just to inform everybody that currently we are vaccinating at the Nelson and Kingston Road, at the Wilson, at Cranmer Road, and we're doing home visits either by the GP practice or care home visits. Currently, we are doing the first vaccinations and thereby invite. So either your practice will phone you up or they will text you and invite you. And your subsequent dose will be within the next 12 weeks. And that will also be by invitation, by text or by contact. So when you arrive at the hub and you've been invited, the volunteers will greet you. They will undertake a couple of screening questions because they want to make sure that nobody who's been in contact with somebody that's COVID positive or has had COVID in the last 28 days comes into the centre. So they want to make sure you're safe and everybody in the centre is safe. So you do have to follow the same rules of distance and wearing a face mask in order to make sure that everybody is safe when they come in. Then you line up within social distancing and they take some of your details and they put them on a form which enables us to do the data entry on our computer system, which is Pinnacle. You're guided through the building at social distance until you meet up with a vaccinator who could be a pharmacist, a doctor or a nurse. They will ask you they will screen you to make sure that you're fit and well, that you can ask any questions you want about the vaccine. And as Sadina has already said, there are 2 vaccines available, either the Pfizer vaccine or the AstraZeneca Oxford vaccine. And it depends on what the NHS supply us with as to what is currently coming out of the clinic or what we're immunising with. So the clinician will ask a series of questions. They will ask you whether you're fit and well, whether you've had a temperature in the last 48 hours, whether you have ever had an allergic reaction to any drugs, vaccine, medicine or food, whether you're on a specific drug called warfarin, because we've got to make sure that you're within the safety range before we administer the vaccine, otherwise you might bruise. They ask if you've had the flu vaccine within the last week or any other vaccines. They ask if you've been in contact with a COVID positive patient in the last 10 days or actually had COVID in the last 28 days. And that is to make sure that you're safe to have the vaccine. Then the vaccinator will administer the vaccine in the upper part of your arm. They will make sure that you've consented to that before they do that, and you can ask any questions that you want. Then you are, depending on which vaccine you have, because with the Pfizer vaccine, we currently have to make you sit in a waiting room for about 15 minutes before you leave for safety reasons. Or if you have the Oxford vaccine, the AstraZeneca, you shouldn't really drive straight away, or if you've had a previous anaphylactic reaction, we just want to make sure you're safe before you leave the building. And the volunteers will look after you. You will be given a card with the date that you had the vaccine and the vaccine that you were administered. So you can have that as a reference. And then you're guided through to the waiting room. You are positioned at distance so that you're safe. And when your 15 minutes is up, you're allowed to leave and go home. You also are given a data sheet about the vaccine so that you've got further information. And as I've already said, your GP will contact you within the next 12 weeks for your second dose of vaccine. And that will be by invitation only, by a text or a telephone call. I think that's all I was going to say, but you can raise any questions in the chat.
Thank you, Fiona. That's really helpful. If we could move on to our next slide, please. And so quite a few questions about who will get the COVID vaccine and when. And so An independent group of experts has recommended that the NHS first offers vaccines to those at highest risk and those harmed by disease and suffering serious complications. And so when it's your time to receive the vaccine, you will get an invitation to come forward and get the vaccination, either by telephone, by letter, by text, in order to do your booking. So we will contact you. Certainly if your time is up and you haven't been contacted, then you must contact your practice, but don't call us until it's your time to get your vaccination. And the next slide, please, Aman. Vasa, I'm going to ask Vasa to talk about how we're identifying who gets vaccinated when. So Vasa, over to you, please.
Thank you, Mohan. So this is the cohort we follow when we invite people one by one. And this is what we mean by saying, when your turn comes, we'll contact you. So the reason we are following this is that based on our experience, sad experience of the first wave, we know the age groups and we know the cohorts, the groups of people where the vaccine, unfortunately, has a high impact, i.e. hospitalization, needing oxygen, supportive ventilation, and sadly, even death. So based on that raw, sad data, our population is divided into 9 parts. And we start with the group which is the most likely to suffer the greatest consequence, adverse consequence from COVID. And that is why we began way back in mid-December, Mohan, remember, we began this journey. We first of all decided that we had to go to our care homes. Then we invited people who were over 80, and the frontline healthcare workers too. Then we went down to 75, and now in Merton, we are really proud to say that we are now working up to group 4. So anyone who is over 70, we would have invited or will be inviting very shortly to attend our vaccine centers. Now, for those who are housebound, our home vaccination program has already begun. I have been on a home visit too, and other staff members from my practice and all other practices are doing home visits to immunize those people who are up to group 4, who are unable to come to the vaccine center for whatever reason, and the home immunization program has already begun. So I'm sorry, some of you might realize that if you're able to go to the vaccine center, you might have got the vaccine a bit earlier. Partly this is due to supply, in the sense that if you have a Pfizer vaccine, it's not suitable for home visits. So the AstraZeneca one is the one we take around with us in vials, and we can use that in home visits. So logistics are the reasons why sometimes the home visit is a bit delayed after the site visit. But in Merton, we are in 1 to 4. And what that really means to us is that those who are in category 5, 6, 7, 8, and 9, your turn will come and we'll get there as quickly as we can. And the age groups, as I said at the beginning, this is all to do with significant harm, including death from the disease. That is the criteria we use. And that is why we stick to it, because we know we want to prevent as maximum possible number of deaths. We have certainly had enough, we don't want any more, and that is why we are going down that strict criteria. Death and destruction, best avoided, vaccine will do it, and that's why we are following this cohort.
Thank you, Bas. I think the next slide will just go through what we have in Merton. So certainly in Merton, we've been, well, this is a Merton webinar talking about the Merton services we have available. So Vasa, can you highlight what the hubs are in Merton?
Yes, so the 2 main places which invite you on to come and have the vaccine is the old Wilson Hospital. It has been there long before I arrived in Merton in the mid-1990s as a GP. And though we call it a hospital, it's not actually a hospital which actually sees patients. It's a hospital which used to see patients, but later on became a health and well-being site, a place people went for physiotherapy and for counseling and other interventions. Now it's a site which is now a place where people go when they're invited to have the vaccine. The Nelson Hospital, again, it was a hospital. I worked there as a junior doctor where it had patients, inpatients. It no longer has inpatients there. It has lots of clinics and surgeries there, but at the moment, a part of the hospital is set aside for people who are invited to come in to have the vaccine. So just to stress, both these institutions, there are no inpatient at all. It's people in the community who go there by invitation to have the vaccine. On top of that, St. George's Hospital also might invite you to attend their site for immunization, and the two mass sites in Southwest London, Epsom Racecourse and Excel Centre.
Excellent, thank you, Vasa. Very comprehensive. So lots of options which we're all aligning and working together to try and get people vaccinated. Next slide, please. Okay, so now I think it's a good opportunity to find out what questions you have, and certainly Aditi, Adil and Sadina have been answering some of the queries in the web chat. I think we've got quite a few people who've got their hands up. So Aman, I'm going to ask you to get those guys to answer their questions or ask their questions, and we'll get our panel to answer them. So Aman.
Absolutely. So would Evelyn, would you like to unmute yourself and ask your question? I'll just go through a couple of the raised hands.
Hi, Aman. Hi. Really, it's two main questions. It's all linked to having the vaccine. Both my husband and I have had COVID over Christmas, and thankfully have mostly recovered and now tested negative of carrying the virus, but we still have symptoms. So we asked our GP if when our turn comes, I'm 53, my husband will be 55 this year, if we still have symptoms, should we have the vaccine or not? Or are there contraindications with specific things? We don't know at this point if we still have symptoms because there is some remaining damage left from the COVID. We don't really know. We haven't had the opportunity to have any tests done. So could I please have an opinion on this?
Aman, I've just answered this question online. Do you want me to go ahead and explain it again here?
Yeah, please.
So Evelyn, I've just typed the answer. It's basically what I'm trying to explain is, first of all, I'm sorry that you and your husband still have got symptoms. And I assume you have contacted the GP, as you said. And as long as you have been, investigated and given a medical advice, which is appropriate and from the GP, you can still have the COVID vaccination, even if you have got long COVID. And it doesn't depend upon the presence of antibodies of COVID, even you have the COVID infection. I hope it answers your question.
Partially, yes. Regarding the antibodies, yes, it does. But what about our symptoms? Are any of these likely to be a contraindication to having the vaccine? For instance, I still have breathing difficulties. My husband has quite bad headaches. So we don't know, will that have any impact? Should we be having a vaccine if we are unwell ourselves? This is the concern, which was not actually, he said he would look it up and get back, but we haven't.
As far as we know, the guidelines is if somebody has got long COVID symptoms and they're generally well, they can still get the COVID vaccination. If somebody's unwell with it, then it needs to be delayed. I would request the panel members to just make sure that it's working.
Yeah, Vasa, did you want to come in?
Yeah, I think you're right. It's very difficult, and and one of the difficulties we have on the panel is that we really don't have enough information to say how unwell are you, because it's very individualized answer. But given that you said that you were positive in December.
Yes, we both had COVID in December.
Whereabouts in December was it?
My husband was positive, I think, from the 15th or 16th of December, and I was positive on the 20th. That's when our tests came back.
Yeah, so we are about 6 to 8 weeks from that time, we could say. Now, long COVID, we say if your symptoms persist more than 12 weeks, then we will say it goes into long COVID. So at this point in time, you're recovering from COVID. Now, unfortunately, some people take longer than others. And if your symptoms are severe, then though it's not an absolute contraindication for the virus, it's a discussion between you and your GP. One has to balance the scenario. The scenario here is, after your first infection, you have developed some antibodies.
Mm-hmm.
The problem is science is not advanced enough to say how long are those antibodies are going to be protective for you as an individual. We can talk about population cohorts, but when it comes to decision making, we had to go down to individual level. For you as an individual, at this point in time, we don't know enough to say how long will that infection in December protect you for.
I understand that.
Therefore, it's a balance. Given you have taken so far 6 to 8 weeks to recover from a primary infection, we got to decide what is the benefit, what is the disadvantage. The risk of delaying the immunization means that you have time to recover, but it comes with a price that if you beat the virus during the period of recovery and your antibody levels are not sufficient enough to protect you, you will, but you can get a second infection.
I understand that. That's my concern.
Right? So you have to weigh it up. What is the benefit? What is the loss? And the equation will shift towards the benefit longer the duration from the index infection to the time of the immunization. So my feeling is 6 to 8 weeks. I think when your GP are right to talk and think about it, but there will come a time very soon where the risk of infection will be more than the fear of any side effects from the vaccine, because we know so far that the vaccine side effects only last for about a week. Most of my peers who have had it had the side effects for a day or two. Data tells me that some people have side effects from the vaccine for a week. So you have to weigh the pros and cons of 1 week of hardship for protection for longer, or risk the consequence of a second infection. So if you are my patient, I'll call you in. I'm tired of telephone. I'm tired of video consultation. So for this type of thing, I say, if you don't mind, come in. There's a glass frame around me. Obviously, I'm masked, and the person is masked. I open the back door in my surgery. That's behind me. And then I say, let's have a discussion. And at the end of the discussion, the patient and I come to an agreed position on whether we immunize or not immunize. So I would suggest you do exactly that. Your GP may not have a back door like me, but I'm sure you'll have a window which he keeps open. If not, you can ask why to be opened, and then you're totally safe, as much as you could be in the current circumstances. Then you have a discussion. At the end of the discussion, you will arrive at a comfortable position where you balance the risks and the benefit, and then we can proceed to vaccinate you. I err on the side of vaccination because I know the side effect is usually for a week. I fear the infection. That is why I err on the side of the vaccination. But that is my personal risk balance equation. It doesn't matter what my personal risk balance equation is. It all depends on your own risk balance equation. What matters to you most will define what you do.
I understand what you're saying, and thank you for explaining that to me. And indeed, I will try and persuade my doctor when the time comes to actually have a one-to-one session with us. My question is, I am pro having the vaccine. My question was, are there any specific contraindications? Are there good reasons not to have it if you're still suffering from long COVID symptoms? That's really my query.
None published is the right answer.
Vaccine if you're still suffering from such as breathing difficulties, etc. That's the
sorry, yes, Evelyn. None published is the right answer, but we must be careful because I really don't like to use the word long COVID loosely, because I've got a lot of friends of mine, colleagues of mine who have long COVID, and it's such a wide spectrum disease. Yes. Some of them are really unwell. Some of them are recovering from being unwell. Some of them have not come to work for more than 6 months now. So I'm highly respectful of this issue of long COVID. And that is where I think we mustn't generalize.
Yes, of course. So it's a case of case by case then, is what you're saying.
Absolutely.
And at the moment, there is no good reason at the moment. There's no data to show that you shouldn't have it if you're suffering from slight breathing difficulties, etc., or headaches. There's nothing to show that it would be dangerous to have the vaccination with those symptoms. That's
absolutely. I've seen nothing published which says that we should not be immunizing people who have symptoms. But go back to the thing about the headache and the breathing difficulties. Have a chat with the doctor, because breathing difficulties now, we are very objective. We do the oxygen levels at rest. We do the oxygen levels after 40 steps of walking. We look for desaturation. There's so much we do now. So I think you should quantify that, and then you'll become more objective. And when you are more objective, you can make more rational decisions.
Great. Thank you very much for your time.
You're welcome.
Thank you.
If I could just add as well, Evelyn, that when you have your first test, your first positive test, you're the only sort of contraindication is that you can't have your jab within 30 days. So you're well outside that now. So that would be that would be the only thing just to add to that, which we do know. Thank you, Aman. Can we get the next caller?
Absolutely. Just before I welcome the next caller, we've had a couple of questions in the chat around carers. So it'd be great to get an answer from the panel. So it's particularly around whether a carer, for example, someone looking after their elderly or vulnerable relative, if they're able to get a vaccination earlier than in the list of cohorts. Would someone be able to answer that question?
Yeah, I'm looking possibly towards Fiona and Vasa to be able to answer that in terms of carers, in terms of when they're able to get their vaccination.
Can I start off answering? So if you are a paid carer or a registered carer, of course you can get the vaccination, or if you work in a care home, you can get the vaccination. The issue arises if you are a part-time carer and you're just popping in and doing the shopping occasionally for your relative, then the only way you would get the vaccine is if you meet the criteria for the cohort that we're currently vaccinating. So you would have to have a comorbidity. You wouldn't, at this point in time, you wouldn't be able to access the vaccine unless you had a particular health issue. Of course, we do make some reasonable adjustments for some individuals, and I think Vasa can elaborate on that.
Yes, I was going to ask Barry, because Barry knows a lot about carers, because in the borough you work a lot with carers more than I do. Barry, are we clear in that position?
We're working through, as Fiona said, the prioritisation list, but we're really pleased to be working with Carers Support Merton across the borough, and really encouraging to our carers within the borough to take part within the asymptomatic testing as well. So again, we can work with those voluntary sector organisations to make sure that our carers, both formal and informal, are supported whilst they are awaiting their call from the NHS on for the vaccine.
Thank you, Barry. Aman, did you want to ask our next call, or next question?
Thank you. So Ajay, would you like to come online and unmute yourself to ask your question? I think you've put a few questions in the chat.
Oh yeah, hi there. Sorry, yeah. The question regarding the care issue. Basically, just continuing. Mum's got dementia, multiple health issues, housebound. We don't have carers as such. Basically, me and my wife are doing it. We had previously a part-time carer privately, but because of the situation, we just stopped, and we're just basically managing as much as we can. So it's getting a bit quite tough, and she's basically housebound. So how would I get to try and get the vaccination? Because I've spoken to GP, they said, oh, their surgery, don't do it, wait for the NHS, rang 119, they don't know, all they say is like, you just have to wait your turn.
Thank you, Ajay. I'm sorry that you're asking that question. Could I just check that we're talking about Merton, or
Yes, Merton, yeah, I'm in Merton.
Merton, okay. Fiona, did you want to just highlight again the housebound, how we're sort of supporting these residents?
So the most important thing is actually to protect your mother with the COVID vaccine. And if she's housebound and she's got dementia, she will be able to get the vaccination within her home by the nurses that are going out, or the GPs that are going out. We are hoping that all housebound patients will be immunised by the mid-February, and we're working really hard to make sure that the GPs can access the vaccine and administer it to your mother. So hopefully, if she hasn't already been vaccinated, it will be happening pretty soon. So as long as we protect your mother, because she's the vulnerable person, and there is testing for you, like the borough's programme, then we're doing the best thing for your mother by protecting her with a vaccine. With regard to yourself as a carer, you will have to wait to wait your turn and your call from the NHS to get the vaccine as per the national schedule.
Thank you. Just lastly, where she gets the vaccine is fine, but won't we be putting her at risk? Like obviously we go shopping, we have no choice. Those sort of things.
So once she's vaccinated, then after about 10 days, she will have some protection herself. And as long as you're keeping your social distance and wearing a mask and washing your hands and reducing the risk to her when you go into her home, then you are doing the best you can. So, I mean, you can do online shopping that gets delivered to her home, so you don't have to, and it can be free. If you arrange it well in advance, so that you don't have to put yourself at risk in the shops. If you feel that that's a concern, you can choose to go to the shops when they are less busy. And I know that's challenging if you're working, but as long as you keep your distance, wear your face mask, wash your hands, you are reducing her risk. And as soon as she's vaccinated, about 10 days afterwards, she has got some protection from, if she gets the COVID vaccine, from becoming more unwell.
Okay, thank you. Just I forgot to clarify. Basically, we just live with her, so we're doing everything. She lives with me.
So you're living in the same home.
Yeah,
So sometimes when you have a discussion with the GP, if you're the main carers in the house, then you can discuss that with the GP as to what your other risk factors are. So, and that will depend on an individual household basis. So if you've got a comorbidity and your risk is higher, then they would immunize you at an earlier stage than somebody within the same age cohort that hasn't got a comorbidity. But I think you can have that discussion with your GP, but we can't immunize every single household participant within a home, because sometimes there are multi-occupancy within a home, 8 people living in a home. We can't immunize that whole cohort just to protect the mother. We have to protect the mother. That's the most important person, not the individuals that are looking after her, because they need to keep the safe distance and washing their hands and making sure that they're not breaking the lockdown rules and putting your mother at risk.
Okay, thank you very much. Thank you, everybody.
Thank you, Ajay. Thank you, Fiona. Aman, can we have another caller, please?
Absolutely. Can Fern, would you like to unmute yourself and ask your question?
Hello, thank you. 2 questions really. What's your opinion on reports from other countries about not vaccinating their over 65s? And also on the Pfizer vaccination, about the 12-week gap that the BMA and doctors and various people are saying should only be a 4 to 6 week maximum gap.
Thank you.
So we can take your question in 2 halves. Can you have the first question, please, again?
Oh, sorry. It's just about the Oxford vaccination of the over 65s. Reports saying that that there's not it's not as good at over 65.
Yes, we have all been watching. Thank you. We have been all watching this news, mainly from Europe, where certain European countries seem to believe that they got limited value over 65. We in England don't believe that. The scientific advice in England still stands the same, that we can give the Oxford vaccine to people over 65, and it's still effective for us to carry on with our program.
Brilliant, thank you. Thank you.
Second question.
And it was about the Pfizer and the 12-week gap, with the BMA and doctors reporting that should be a 4 to 6 week gap maximum.
Yes, so this goes back to where England was as a country as we came back after our Christmas. At that point in time, England woke up to the reality that our case rates are very high, our hospitals were full, and our death rates did reach 1,000 a day. And at that point, England had to make a decision. And it goes back to the issue of our ethical, moral principles and duties to save as many lives as we can. And if the evidence and the situation changes, not to be dogmatic, to stick to one policy, but have the courage and the conviction to change it. And that's what British scientists did, and that is what the British government followed. It goes back to the issue here that if you had 2 vaccines and you have both your parents who are vulnerable, would you give one each to one and save both of them in the middle of January, or say to one, you can have both 21 days apart, and to the other, take your chances? That is where we were in January. We were not in a comfortable position, and everybody knows that. In that situation, the right decision was made that we do not immunize half completely. It's better to immunize full completely by a 12-week gap. And now the evidence, actually, just driving in today, I was very pleased to hear that the evidence is actually supporting the decision making. And I think what this pandemic has taught us is that we got to be fleet of foot. We have to make difficult decisions when we have to make them, because there is consequence. There is consequence for not making decision. As much as there's consequence for deciding, there's also consequence for not deciding. And I'm really happy we made the right decision, because the consequence for not deciding there, and if we had gone on to immunizing people after 21 days, we would have denied others the chance of the vaccine. And that brave decision, because it was brave, because I know people opposed it. But leadership is about doing things, even if people oppose, to what is right for the country. And it was absolutely right for the country to say, let's widen the gap between dose 1 and dose 2, so that a greater number gets dose 1. And I know there's opposition, there'll always be opposition. But what we have to look is the big picture. The big picture has to be save the greatest number of lives you can save, prevent the greatest number of admissions to intensive care or supportive ventilation, which you can save the greatest number of people who need oxygen, because oxygen became a commodity which could have run short of, but we didn't run short of it because we made wise decisions. So I think that is my answer, and I'm sure other panelists would like to come in if they wish to.
Thank you, Vasa. Anyone else want to answer that? I think you've answered it fairly completely there, Vasa. Thank you, Fern. Aman, so we take the next hand, please. We are coming up to almost the hour mark, but I think we'll continue because we're having good conversation here. So, Aman.
Yeah, absolutely. Tony, would you like to unmute yourself to ask your question or share your thoughts?
Can you hear me?
Yes, we can.
Yes.
Yeah, thank you. Yes, I'd just like to take up this point of the second vaccine, the second dose, because I understand everything you've been saying, but there is a difference between the AstraZeneca vaccine, where 10 to 12 weeks seems to be okay, but the Pfizer vaccine, where Pfizer themselves, the manufacturer, have said the second dose should be 21 days, and the WHO says 3 to 4 weeks. And even a lot of GPs are saying you should not wait 10 to 12 weeks. There's no scientific evidence at all to say that that's a good thing to do. I'm slightly biased in that I'm very, very pleased to have had my vaccine 2.5 weeks ago. It was a Pfizer. I'm 75, and I'd just like to know what's going on in terms of supply of Pfizer in the next few weeks.
Thank you very much, Tony. Vasa, did you want to answer that again? I was going to bring in Dina actually as well. Yeah.
Thanks, Mohan. Absolutely. There is no doubt that Pfizer is saying something different to AstraZeneca, and there is no doubt that AstraZeneca has published more data which supports the current position. Pfizer, my opinion is Pfizer makes drugs, it supplies it to governments. Governments have to decide what each individual sovereign state's vaccination policy is. And that is the UK government decision. Now, Pfizer, because it's a private company which makes drugs, will always hold on to its line. But if you look at the humanitarian reason why the policy was changed, that is government responsibility. That is not drug manufacturer responsibility. So I think both parties are entitled to what they're currently saying and doing, but we have to look at what the situation we were facing. We're still not out of the woods at the moment. All what we are saying now is our rates are coming down, but the hospitals still have got enough patients there, enough and more patients there who are still suffering and recovering. So as we stand now, I think that decision still is valid on the basis of humanitarianism. And that sometimes in life, we have to go down that route when we are faced with difficult situations. But you're absolutely right to say Pfizer is not supporting that.
But I understand what you're saying, but can you explain me how it is that many other countries insist on giving the Pfizer vaccine within 3 to 4 weeks? I have friends who've had the AstraZeneca vaccine in the last week or two who've been given a date in 10 weeks to come back. But all the people I know who've had the Pfizer vaccine haven't been given a date at all. So I'd really like to know what's going on.
So Mohan, correct me if I'm wrong, in either of these sites, in Wilson or Nelson, we're not giving anyone any follow-up dates at the moment, 12 weeks later, are we?
No,
Correct.
we're not. We're not. It's Dina here. It's only the mass vaccination sites that are given the second appointment when they administer the vaccine. So because the way that patients are filtered through to the different services are different. So for the clinics in the Nelson and the Wilson, a patient is invited through their GP practice, inviting them to come to the clinic. The mass vaccination sites, the patients go on and book their own appointments. So when they go and they book them, both appointments are booked at the same time. So it's just a case of a different system. But rest assured, if you've had the Pfizer vaccine in a community clinic, you will be invited back at the right time. So please don't feel that you've been forgotten. You absolutely haven't. We've already started planning the next round of vaccinations for those who had the Pfizer vaccine as the appropriate time is coming up. It's simply a different system. That's all it is.
Yeah, I'd just also like to add, yes, we're not giving any second doses or second dates, certainly in any of those hubs. We've vaccinated over 20,000 residents in Merton, and therefore a lot of those were Pfizer, and so they will need their second dose. So we will certainly be recording those when the time is right for that to happen.
Okay, that puts my mind at rest a bit more. Although I'm intrigued to know how you will do the logistics of the second dose when you're still trying to give people the first dose. Must be very complicated.
Thank you, Tony. I really appreciate that question, because that in that question, you're actually appreciating how hard our clinicians are working on site to do both, to go after those cohorts for the first and then go off after the dose for the second. Yeah, it's a hard task, but you know what, Tony, my clinical team in Merton is totally motivated. I don't get any complaints from them. Fiona in particular works every Saturday and Sunday at the vaccine sites. The reason, Tony, is that we see the suffering in society. We see what our patients have been through, and more than that, we also see the suffering of our hospital colleagues, Fiona's colleagues and my colleagues, how they are working with the current caseload, and we owe it to them. So don't you worry, Tony, we will deliver. We in Merton will deliver. And that is a commitment we have for the people of Merton, because we owe it to each other to get on with it and beat this virus and get back our lives.
Yeah,
Fiona, do you want to come in, Fiona?
Well, we have a wonderful team of volunteers as well, and a big thank you to them, because without them, it would be incredibly difficult to run our clinic. So our volunteers are just as committed as the clinicians in Merton to serve the population in Merton. So a big thank you to them too.
Yeah, no, it's very impressive. So I can be sure then that even if I have to wait 10 weeks for my second Pfizer dose, I'll be totally immunized like if I'd had it after 3 weeks.
You will be.
Yes. Can I just say that they have made more space at the Wilson? There are a further 2 rooms that have been made into clinics. So there is more capacity for immunization, and we are looking at that. We are evaluating the space that we have and making it as efficient and as safe for patients with regard to distance. And we are working already on making sure that we have enough capacity to be able to carry on with the first immunizations and yet deliver the second ones.
That's very good. Thank you for that. Thank you for answering my questions.
Excellent. And I just want to add as well, in these unprecedented times, we've really come together. The army have also been deployed and coming to our hubs and also giving the vaccination. So we are seeing some extraordinary efforts. And 2 months ago, we wouldn't be thinking we are where we are today, having vaccinated over 20,000 residents. So that next logistics, we can make that happen. Aman, can we move on to our next caller, please? The next question.
Stephen, would you like to unmute yourself and ask a question?
Yes.
I know you've been patiently waiting.
Yes, I'm sorry to go back to this Pfizer and the delay, but you're not quite accurate in what you say, in as much as there's not been any studies. In the BMJ, they reported on the Israeli study on multi-thousands of Pfizer vaccinations, where they found there was a definite drop-off in how well the Pfizer vaccination worked over a period of time. And this was a medical investigation over multi-thousand people.
Okay, thank you. Vasa, do you want to answer that? I mean, it's resonates with similar
yes,
theme
the,
to what you've been
yes,
saying.
the British scientists have seen that paper, so have we. And the issue here is that given, I think each country has to make a decision for what is good for that particular country. So if where UK was, UK had to make a decision for the benefit of the greatest number of people in the United Kingdom. And therefore, that is why the decision was made. And if the evidence changes with time, then we would be able to change the decision. But at where we stand, just out of January, early days for us to say that gap is too long. That's why I'm saying the gap still stands. And I can't predict how long that gap will stand for. But at this point in time, given where we are, for the greatest good for the greatest number of people, because that is the formula we follow. And that is the reason we arrived at that gap.
Can I just add?
I perfectly appreciate why the government did it, and I understand that. But all I'm saying is that the Israeli investigation actually showed that the government was incorrect. And why are we in danger after 6 weeks? I was very grateful to get my Pfizer vaccination, by the way. I think everybody's absolutely wonderful. I'm just querying the fact that the government have made that decision.
I just given you right to query it, absolutely right to query it. The fact is, I won't want to individualize it to you, so I will not bring you into my discussion. I will go back to my global discussion. The question we have to ask ourselves is, are we better off giving the vaccine to 2 people, maintaining a 12-week gap, or are we more justified in giving it to 1 person and maintaining a 21-day gap? And that is the question we have to answer. And that question we have answered on the basis of a long-standing ethical principle: save most number of people you can save in any dilemma. And that was the dilemma we faced. And that's why we arrived at the discussion, at that decision.
And if I could also add as well, that's the sort of national stance across the whole of the UK. So it's not unique to Merton. It'd be very difficult to sort of go against that. We take your point, Stephen. I think there's lots of debates, lots of research. This is quite a new, vaccine. But actually, the MOHRA, whose full-time role is to look at this, have decided that actually this is what we're going towards. Saqib, I think did you want to add? I saw you kind of itching in.
Yeah, I thought, to put it into context, Israel is a very much smaller country and the population is very much smaller. I think you'll find that, we've got 65, 66 million people in this country to vaccinate. So our priorities are going to be to get the maximum number of people vaccinated with the supply that we have. So as Vasa was saying, we have to make difficult decisions. The logic is there for the vaccine. We all believe in this vaccine. Most of us have had the vaccine. So essentially the logic is there. That we know it's safe. We know that it will confer some immunity. We don't have the exact data for the Pfizer vaccine if you're only given 1 dose, but we do know that it will afford some protection.
Thank you, Saqib. How's that, Stephen? Is that okay? Does that answer your questions, or give a reply?
No. I'll rest on it. Actually, I would just point out the fact that the government made the decision before the Israeli investigation was reported. So I'll leave it, but I'll leave it. It was a point I just wished to make, that's all.
Thank you, Stephen. Aman, I'm just going to see whether there's any, the guys who are doing the web chat, whether they've got any themes they want to mention or bring in. So Aditi, Sadina and Adil, is there anyone, any sort of themes that you want the rest of the group to be aware of?
Yeah, Mohan, I'll take it first. Sorry, everyone, it takes a little while to type, so apologies if we haven't replied to all of your questions. We're trying to get through them as quickly as our fingers will go. I think there's a few comments generally about carers and how important they are, and we recognise that absolutely, and I think colleagues have commented also on what an important job they have, and there was also a comment about volunteers, and equally that how fantastic our community is, and the importance of the volunteers at the vaccination sites and how they've helped everybody who's come along there just to guide them of where to go, and to provide a bit of reassurance for people, especially when they're not sure where they're supposed to be or where they're supposed to go, and they're there on hand to help you. And I mentioned last week, even with accessibility, so if you come in a wheelchair, again, there are ways for you to access the sites, and the volunteers can guide you again if you're not sure where to go. So that's been one of the themes. There was a query also about sort of the debate you've had just now around the different types of vaccines there. And then a few other specific ones which I've put the email address on for you. So some people had specific queries. So there's an email address, and perhaps, Aman, if you want to just put it back on there, please feel free to email on that address if you have specific queries. For example, somebody wanted to know how to complain about home visits. So please feel free to email that address, and we'll try and help you with that as well. I hope that helps.
Thank you, Aditi. Any of the other guys got any themes they wanted to mention? Sadina?
Can I go ahead?
Sure, please.
Sadina.
Please, Adil.
Few specific questions actually regarding clinical picture of somebody who is not well, and when they can have the COVID vaccine. Thing we touched upon initially, about 28 days from the diagnosis of COVID or beginning of symptoms. Then there were queries about what about the blood thinners? Okay, if somebody was on blood thinner. So it's very difficult to give a specific answer without knowing much details. So I would appreciate, if we contact the GPs and find out, exactly when if somebody needs blood test, if somebody is on warfarin, whether they would need blood tests and whether it should be in the normal range. So those specific questions, I think it needs to be dealt by the GP actually.
Okay, thank you, Adil. Sadina, did you have anything you wanted to add? Maybe about?
No, there was nothing specific. I think there are a lot of questions about efficacy after the first dose and efficacy after the second dose. And I think the key thing to note is that for both vaccines, you get about 50% after the first dose, and the second dose is to elevate that to anything over 20%. So, the government immunity, which, as Vasa explained, is better than not having any immunity at all. That having the first dose gives you a good level of immunity, and you still have to stick to the restrictions, wear your mask, wash your hands, and social distance after both doses. Because even after you've had both doses, it's not 100% guarantee that you won't have severe infection if you did catch COVID. So that's the key message around efficacy and the effect that the vaccines have.
Excellent, thank you, Stina. Let's pass over to Aman. We've got about just over 20 minutes. Aman, did you have any further hands up which you wanted to bring?
Yeah, of course. I've got one remaining hand actually.
Sure.
Mitchell, would you like to unmute yourself and ask a question or share your thoughts?
Yeah, hello, good evening. So thanks for allowing me to ask this question. Okay, so my experience, I had written it down, but my experience has been very disappointing. I have two vulnerable individuals at home. and a COVID vaccine appointment had been made for a home visit. However, my surgery partners with another surgery, yet my surgery has no details of the COVID vaccines at all. All that happened was they rang me and asked me, would we like to have a vaccine? The answer was yes, and I asked whether I, as the primary carer, could have one as well, and that they said, okay. So as you quite rightly said earlier, it is on a discretionary basis. So that was arranged, and yet nobody turned up. There was no phone call. There was absolutely nothing at all, no text, no nothing. And I was really, really angry because I had put aside my entire day. One of the individuals is autistic, so you can't just turn up. I have to coax this person with autism and let them know and ensure that they'll be in the right frame of mind. And even saying that, it's hit and miss whether they're going to allow somebody to put a needle in their arm at the time. And the other one has dementia. So there was no phone call whatsoever. I rang my surgery, they didn't know anything and were unable to help me. And they were apologetic, but it's just not good enough at all. It's really not good enough because I have a number of other things to be thinking about throughout the day. One of the vulnerable individuals also is recovering from cancer as well. So I have a lot on my mind. Yeah, so I'm just not happy, and I did put it there, and I know that the answer was that you can make a complaint. I haven't got time to be sending emails to be making complaints. In the meantime, I have had another conversation with my GP, and hopefully one of the GPs will come to do it for us. But I just wanted to relay that we've seen on the TV how many people have been really impressed at the efficacy of the vaccines being done at various hubs. And I'm just really disappointed that that's not been my experience for them coming to the house. Nobody knows. When I ask, is there a specific time or is it between 8 and 5? Nothing. We don't know anything about, sorry, we can't give you any information at all. And then I got another call to say they're going to come tomorrow. And I said, well, I have an appointment tomorrow at the hospital tomorrow afternoon. So could you tell them not to come in the afternoon? But they still turned up in the afternoon as I was coming out the door. So for me, it just seems really disorganized, and it doesn't instill much faith or confidence in what's going on where home visits are concerned. I then got a text to say I'm to come to the surgery, book an appointment to come to the surgery for a vaccine, and my mother's to go to the surgery when she's housebound, but nothing for my son at all. So it just adds insult to injury, and I just wanted to air that I'm not impressed.
Thank you for sharing that, and I'm sorry to hear your story in this particular case. I'm going to call upon Fiona if she would just like to add anything to this particular case or in general, because I know the team been working very hard with everything, but also some of the housebounds. But in this case, certainly, something probably needs to be looked at. Fiona.
Yeah, so I would like to offer my sincere apologies for what has happened to you, especially if you've got a child with learning disability, and I understand the additional stress and pressure that you have. I think offline it would be helpful to know which surgery it is to make sure that that we can help them make sure they can access the vaccine. As you can well imagine, there are 22 practices that are all trying to vaccinate their housebound within the last week and this week. So it has been incredibly challenging. So, a big practice might have over 100 patients that they've got to vaccinate. You can only vaccinate with the AstraZeneca vaccine, which is 11 doses per vial, and that means maybe 22 patients per day logistically. So it is challenging for practices, not only just to do the work that they have to do, this is additional work they have to manage. So I'm really sorry that you've had this bad experience. I would like to personally help you make sure that you get your vaccine because of the issues that you've got, and I will do my utmost to make sure you get vaccinated within this next week, even if it means I come and visit you.
Thank you, Fiona.
Thank you very much. Thank you.
Mitchell, if you could maybe share your details to that email address, and then for attention of Fiona, we can certainly pick that up.
Thanks very much indeed.
And I think if that's the last hand, I think we might revert back to the presentation. We just got a couple of things we want to do to tie things up. Aman, do you want to just put the slide deck back up?
Just give me a quick.
Just wait for that to come up, and I think we're going to ask Beck to, if I'm not mistaken. So yeah, so we've done this one. So we're on to the next one. So I'm going to pass over to Beck now from Health Watch Merton. Beck.
Thanks, Mohan. Yes, as Mohan just said, my name's Beck. I'm from Health Watch Merton. I mean, Health Watch Merton, if you haven't heard of, is actually trying to capture the voice, the opinion, the experiences of our Merton residents in respect of health and social care. I'll pop in our actual website just in case it's something you've never come across before, and if you wanted to find out a bit more about what we do outside of this session. So we're just going to launch 2 polls, and the first poll is around people's plan to have the COVID-19 vaccination. Obviously, we've heard from a few people here today that have actually had it already, and that is one of the options. But it's also just to get a gauge of whether these webinars, which I think are are fantastic, we've got such expertise in the same room, is actually helping you make an informed choice. So I'm going to launch the poll now. In a moment, let me just get rid of the chat. Okay, you're going to launch the poll. Here we go. So you will see a poll pop up onto the screen. If you could just pop the response that fits with you, whether you feel you were always planning to have the vaccine, whether actually attending this seminar today your view has changed, whether attending this seminar it might have changed it in the opposite end, and whether potentially you're still thinking. It's left you with the maybe I will actually plan to have the vaccine. So it's just to get a kind of a rough idea. Obviously you're being forced to engage in this poll. So any people, we've had 13 people, 14 so far that have come forward. Obviously there's a number of people on the 33 that could vote who are panel members. So just give it a few more moments. We're up to 15, 16, and we will stop there. So about maybe 17, it's creeping up, 18, going once, going twice, 19, and here, that's it. We're going to stop the poll now. So just going to share the results so everyone can see. So 47% of the numbers that voted actually were planning to have the vaccine. Again, we had 2 people actually just following this this seminar, this webinar. They've actually has changed their view. So thanks so much for that feedback, which obviously is very valuable and is a great measure of reflecting on going forward and planning future sessions. We're going to now give you one more question, and this is around future sessions. So it's basically asking whether there should be more East Merton focused sessions. This is multiple choice. You can add in a few. It doesn't have to just be one. And if there is any other ideas of sessions similar to this, please do post those specific ideas in the chat. So if you've got any specific ideas of other thematic sessions linked to the COVID vaccine, and then please do pop that into the chat. That would be much appreciated. So we've got a couple of people so far that voted. If you take a few moments just to add your ideas, it's starting to creep up now. And obviously this is very valuable. Again, it helps us in respect of planning future sessions and ensuring that we are addressing some of the concerns that are coming out from our communities. 13 so far voted. So obviously, yeah, you can make a number of choices. So we're going to end the poll very shortly up to 14, 16, and we're going to end the poll now. Okay, so if we end the poll there, and here are the results, and you can see, so yeah, there seems to be a East Merton and West Merton specific sessions. Most popular actually a women's health session, and a vaccine skepticism. Actually, that is the most popular in the BAME community, and there is one person that has posted a specific idea in the chat. So thank you so much. That is the polls at the end of this session. Thank you.
Meg?
Yes, Vasa.
What was that specific idea? I'm curious.
I'm not sure.
There's a couple on the web chat. One has put Catherine's put carers, and Lynn's put mental health sessions. So it may be related to that.
Thank
you. But unless you've got another way of showing it on your computer, Beck.
No, it's just that, yeah, the ideas will pop up in the chat.
Yeah, I think it's mental health sessions, isn't it? Yeah, it's good. Good idea. Yes.
Thank you very much.
Thank you. Okay, so if we close that, and can we move us on, please, Aman? Barry, I think you're going to close up here, aren't you, with a couple of slides?
Yeah, thank you, Mohan. And as kind of Mohan and Vasa and the rest of our clinical colleagues have touched on, that we do know that cases within Merton are reducing, albeit slowly. But our cases are still high across Merton and across London, and there are still a number of people in hospital with severe disease. So it's really, really important that we listen to the key messages, and these are around that the vaccine is safe and effective. It does give you the best protection against coronavirus. And also testing. Testing is really important to help us break that chain of transmission. So there are two different types of testing. The first one is when you have symptoms. So if you have any symptoms, so a high temperature, continuous cough, or loss of change in taste or smell, even mild. If you're not too sure, if you think perhaps it's one of those symptoms, we would encourage you to self-isolate and get a test via the NHS website. The second type of testing, as we've touched on earlier when we were talking about the importance of carers and volunteers within the borough, is asymptomatic testing. And again, we are encouraging all of our frontline workers, volunteers and carers to take part in regular asymptomatic testing. And for those tests, you can book via the Merton Council websites. We'll make sure that we share those links with you. Next slide, please. And again, as we've touched on, vaccines are one part, a very important part of our defence against COVID-19, but we still need to make sure that we're following those non-pharmaceutical interventions, hands, face and space. And a really important message, and I think it's come throughout the workshop last week and this week, is about the importance of working with our communities across Merton. We're working incredibly hard with our voluntary sector, who are doing amazing things across the borough and across London. But we do know that COVID is impacting all communities, but some more than others. So again, we're working with voluntary sector organisations and groups that are supporting BAME groups, carers, older people, children and young people, and our residents with learning disabilities. And so I think it's really important that if you have any ideas, if you have any opportunities, if you have any newsletters or webinars in the neighbourhood, we are more than happy to attend those sessions to help us increase the understanding of what our messages are and how to take them forward. The final point from me is really that we also have a network of community champions within Merton. We've got 148 of those so far. So we meet every single week. We meet at 12 noon and 7 p.m. And our champions just drop in and we have an ongoing conversation and dialogue around COVID-19, what the key messages are, so that we can share them with you, so that you can share them with your communities. Just noting Lynn's comment and suggestion of the mental health focus, this week's community champion session focuses on mental health. So it'd be fantastic if we're able to share the information with those attending tonight, so you can take part in that conversation where we listen, where we explore the issues, and we work together on some potential solutions. But thank you for listening to me on those key messages, and I'll hand back to Mohan.
Excellent, thank you, Barry. And I've just realised I didn't ask Geeta. Geeta, did you want to mention anything just right at the death? Sorry, I didn't bring you in sooner.
I haven't got much more to add. I just please feedback if there's anything else that we can do to help. Any of the communities that are involved, any of you who'd like to take part. I'd also like to echo what Robert, I think Robert was the one who put it on the chat, that this is Sunday, and we're really grateful to all of you on the expert panel your GPs and the non-medics as well. You work so hard. You're working so hard during the week and on Saturdays. Sunday's your only day with your families, and we're just really, really grateful that you're taking all this time last week, this week, and in weeks to come, just to share your expertise and help answer all our questions. So thank you to all of you. I've got nothing else to say. I've learnt a lot today anyway. Thanks.
Thank you, Geeta. Aman, if we move on to our last slide, I mean, there's not a lot more to add really, but again, thank you all for attending today. And I think thank you all for being able to ask wee questions, and it means a lot to all of us. And this, we're all able to share what great information we have to help each other. And we hope you found it useful. It was a very good interactive session, and also we had some themes about what to do next. So we will feed back any questions on a frequently asked questions sort of sheet, which we'll send out, and also the web link as well through the YouTube channel. So yeah, lots to look forward to, and thank you all. Thanks again. Thank you again for the panel, and have a good rest of the Sunday. Thank you.